Okay, knock, knock. Close the door for privacy, wash my hands. Hi, my name is Sarah. I'm gonna be your nurse for today. Okay. And I'm continuing my assessment on Mr. EMOTO. I already swiped and did my vital signs. Okay, do you know where you are today, Mr. EMOTO? Fortis Hospital. Do you know what date it is today? 5/21, good. And do you know why you're here? Heart failure complications, yes. Okay, I'm gonna shine this in your eyes. Okay, follow the pen for me. Pupils are equal, round, and reactive to light, and they are also able to accommodate, and also the patient is alert and oriented ×4. Oral mucosa is pink, moist, and intact. Skin is non-tenting. Mr. EMOTO, have you had a cough? Yes? Okay. Is it productive or non-productive? Productive? Okay, and what was the color of that? White. And the consistency, you said, is thin. And about how much are you coughing up? About 15 milliliters. Okay. So I'm gonna inspect the thorax. Chest rises symmetrically. I'm gonna auscultate 8 places on the front and 10 on the back. Okay, here's some crackles in the lower lobes bilaterally, and respirations are regular rate and rhythm, slightly labored. Okay, I'm going to listen to the heart now, starting with the second intercostal space to the right, which is the aortic. S1, S2 noted. Second intercostal space to the left is the pulmonic, S1, S2. Third intercostal space to the left is Erb's point, S1, S2 noted. Fourth intercostal space to the left is tricuspid, S1, S2. Fifth intercostal space, midclavicular line, is the mitral, S1, S2 noted. And I'm going to flip this around. Listen to the apical pulse for a full minute. So a full minute has gone by, and the apical pulse is 102 beats per minute, and it is regular. Ouch. Okay, I'm going to assess the brachial pulses bilaterally. They are +3. Radial pulses, +3. You squeeze my hands, push down and pull up. Bilateral upper extremity strength is a +5. Capillary refill on both sides is less than 3 seconds. I'm gonna assess the IV site. Dressing is clean, dry, and intact. There's no redness, swelling, or infiltration, and I would flush, and the dressing is dated. Okay, Mr. EMOTO, when was your last bowel movement? Last night? Okay, and what was the color? Brown? The consistency? Soft? Was there any unusual odor? No? Okay, and about how big is that? Or what size was that bowel movement? Small one? Okay. So I'm gonna assess the abdomen. It is flat and non-distended. I'm going to auscultate in 4 quadrants, starting with the lower right quadrant. Lower right quadrant, bowel sounds are active. Upper right quadrant, bowel sounds are active. Upper left quadrant, bowel sounds are active. Lower left quadrant, bowel sounds are active. Okay. Now I'm going to palpate in those quadrants and feel for any pain or tenderness. Starting with the right lower quadrant, no pain or tenderness. Right upper quadrant, no pain or tenderness. Left upper quadrant, no pain or tenderness. Left lower quadrant, no pain or tenderness. Okay. And when was the last time that you urinated? Don't remember? Okay, what was the color? Dark yellow. And was it clear? Was it cloudy? It says it was cloudy. The amount says it was less than 100 milliliters. And did it have any smell to it. You said strong smell. Did you have any pain, urgency, or frequency? And you said that you had a decrease in frequency. Okay, so I'm gonna lift the gown up, assess the genitalia. There's no presence of lesions, edema, abnormalities, discharge, or sores. So I'm going to place that back down. I'm gonna come down and assess the lower extremities. There's some +3 pitting edema. The skin is warm to touch, it's dry, and there's no presence of skin breakdown, lesions, or sores, anything like that. So I'm gonna come wash my hands, put on some gloves, and assess the feet. Okay. Dorsalis pedis pulse bilaterally is +1. Posterior tibialis pulse bilaterally is a +1. Capillary refill on both sides is less than 3 seconds. Can you push down? Pull up for me. Okay. And the strength on the bilateral lower extremities is a +5. Take my gloves off, wash my hands. All right, Mr. EMOTO, I'm all finished with my assessment. I'm going to be in the room, but I'm going to go call the doctor. So I'm just going to put the bed down and the rails up for your safety.